monthly public health webinar 5.0 on snake bites, insect stings, the do's and the don'ts. My name is Dr. Edith Bright. I'm a medical officer with eClinic and Diagnostics, and I'll be anchoring the webinar today. Important to mention that this webinar is proudly brought to you by eClinic and Diagnostics Limited. We're located at number 3 Agade Street, Wuse to Abuja, and also at number 7 Factory Road off Ezuko Road, Aba, Abia State. We are a multi-specialist healthcare facility with focus of radio diagnostic services. We render radiological services including high-tech imaging such as CT scans and MRIs. Also render dental services. We have a 24-hour standby pharmacy, and then laboratory services, and of course our general outpatient care department, emergency services, and a lot more. We're all gathered here today because snake bites and insect stings is more than just experience. It can be life-threatening, and having the right information and the right knowledge can help us reduce risk and also save lives. Our presenter today will be Dr. Jama, Dr. Omar Musa Jama, who is a dedicated medical officer with Clinic and Diagnostics. And she'll be sharing our insights on snake bites and insect stings and what we can do. We'd also like to acknowledge the presence of our medical director, the person of Dr. Obi Inagi. Thank you, sir, for your continuous mentorship. And I would also want to note that we would have a question and answer session at the end of the presentation. So we would urge you all to kindly listen attentively and then type out your questions on the chat box. And also at the end of the presentation, if you do have any questions, feel free to raise your hands. Without any further ado, I would like to hand over the floor to our presenter. Dr. Jama, you do have the floor. Thank you.
Thank you so much, Dr. Edith. As she mentioned, I'm Dr. Jama, and today I'll be talking to you about snake bites and insect stings, the do's, the don'ts, and evidence-based management as part of our monthly public health webinar. This is 5.0. This session focuses on practical management of snake bites and insect stings, especially in our local context. The aim is to correct harmful myths, to recognize danger early, and know when urgent medical care is required. Please remember to mute your mics so everyone can follow and there won't be any distractions. Thank you. So the learning objectives for this presentation today is by the end of this session, we want our participants to be able to recognize the common signs and symptoms of snake bites and insect bites, to be able to identify the danger signs so you can know when to go for urgent medical attention. Also to be able to provide safe and correct first aid, because this first aid actually saves lives in a lot of people. To avoid harmful myths and unsafe traditional practices, as well as apply these simple prevention strategies to reduce risk at home and outdoors, I'll be presenting today. Now, the presentation would go with this following outline. We'll be taking your questions and discussing them at the end of the presentation. Now, snake bites and insect bites are common medical emergencies worldwide, particularly in tropical and rural regions like Nigeria. While many bites causes only mild local reactions, some of them can actually lead to even severe systemic complications, permanent disability, or even death if not recognized and treated on time. The World Health Organization has even recognized snake bites envenoming as a neglected tropical disease, highlighting its significant global health burden, especially in low research settings like our own. Now, insect bites also can pose serious risk, including severe allergic reaction, which is usually the most concerning, or even toxic envenomation in some certain types of scorpion and species of spiders. They can also transmit infectious diseases such as mosquito transmitting malaria, and we also have yellow fever. Now, early recognition of this and appropriate first aid, as well as evidence based medical management, are critical and known to reduce mobility and mortality. Delayed presentation, harmful first aid, lack of access to antivenom can contribute significantly to morbidity and mortality. Now, let's start the discussion with snake bites. Globally, around 4.5 to 5.4 million snake bites have been recorded annually, with half of those having envenomings each year. Over 100,000 deaths each year too have been recorded, and many more of them have ended up with disability. In Nigeria, we have an estimated 15 to 20,000 cases recorded annually. These are cases that were recorded. Many cases are not even recorded because not everyone goes to the medical centers to get treatment. Some of them are treated at home or locally. Snake bite is common, especially in savanna and rural areas, and higher incidence is seen during rainy season, especially due to increased human-snake interaction during this period. Nigeria bears a significant burden, particularly in farming communities, especially. Who are those at risk for getting snake bites? We have farming, herding, outdoor work, those working barefoot and unprotected, for example, in the farm, those involved in bush clearing and poor housing gaps, nighttime activities, especially without a light source, and those with animal husbandry, like those rearing chickens, for example. Snakes have an appetite for the eggs, chicken eggs. Now we have different classification of snake bites. We have the non-venomous and the venomous. Not all snakes are venomous. However, distinguishing if it's a venomous or non-venomous snake at the point of care is very important. Okay. Now, the non-venomous, they do not administer or inject venom into the body. What they do mostly is to constrict. So usually they will bite to grab, then they kill their prey by squeezing the prey. Then we have the venomous. These are the ones that deliver the toxin into the system. Example are the elapids, the types of snakes that have venoms, and the vipers. They usually cause severe local and systemic effects in the presence of envenoming. Now, there are different kinds of venom effects. They depend on the species and the venom composition. Patients may have local tissue damage, bleeding tendency, paralysis, muscle breakdown. Some may even have mixed features. Example are those that have cytotoxic effects. They destroy tissues. We also have the one that affects the brain and spinal cord. They can cause paralysis, respiratory failure, the one that can cause bleeding disorder. These are examples of some of the venom effects. Like I mentioned, it is dependent on the species and the venom composition. Now, we have three common venomous snakes in Nigeria. We have the Echis ocellatus, or the carpet viper. It is usually the most common cause of recorded cases of snake bites in Nigeria. The other type is the Naja nigrocolis, also known as the black-necked cobra. It often causes neurotoxic effects. Then we have the Bitis aeratans, or the puff adder. This one usually causes severe local tissue damage. You can see in the pictures attached. These are images of what they look like. Now, some of the symptoms that can occur after a snake bite, we have the local symptom, which is around the snake bite. They could have bleeding, you will see the fang marks, some may even have discoloration, burnings, it can be painful as well and even lead to swelling. These are the things that you can see around the bite side. Then we have systemic effects. From the top, we have the central, it can cause dizziness, fainting, headache, even vision blurriness. Then heart and vessels could be affected. For those, then we have the muscle, for those that are biotoxic, can affect the gastrointestinal. These are some of the signs and symptoms. Not everybody will present with these. They may or may not present with all of these, depending on the envenoming, if there's envenoming or not. Now, going to one of the most important things, the things that I want you to remember and take home today. First aid. First aid is very important. This should be the first point of care in any case of snake bites. This is something you usually do in the community. Remember, there is an acronym. It says "Do Right." That is the acronym for first aid for snake bites. The do's. Do right. What does this right stand for? Reassure the patient. This will help the patient stay calm. And it is important to note that only 7% of all snake bites are actually non-venomous. 70% are from non-venomous snakes. Then out of the that are venomous, only half of these actually inject venom into the person. So you want to reassure the patient to help to keep them calm. The I stands for immobilize beating limb with splint or sting. You want to immobilize the affected area. Most snake bites commonly occur around the limbs, the arm or the legs. So you want to immobilize it like you would do for someone who has a fracture. No compression in the forms of tying tight ligatures or applying tourniquets. So this image, as you can see the image attached, you can see what it looks like and how it is done. Ideally, you should be able to slip a finger or two in there. That's how you know it's not too tight, but it's tight enough. Okay. What this immobilization does is when after a venomous snake bite, the venoms usually spreads through what we call the lymphatic system, right? So this pressure immobilization, it does two things. It causes compression. The compression will slowly reduce or slow down lymph flow, delaying the spread to the heart and major organs. It will also immobilize the limb, preventing muscle contraction, because when your muscle contracts, it speeds down the lymph flow. So it prevents the muscle contraction, also slowing the lymph flow. That's why this immobilization is the best rather than tying tourniquet. Then get to the hospital as soon as possible. Ideally, anybody with snake bite should get to the hospital. Let it be determined at the point of care if it's venomous or non-venomous. Then tell the doctor what happened. You can explain the doctor the circumstances that happened, the site of the bite, all the information you have, if you have any information on the snake. Please, let's take a look at the picture again. This is the right way to immobilize a beaten limb. And then you want to keep the stricken limb below the heart level, again to reduce spread through the lymph flow. Now, we have the don'ts, first aid don'ts, okay? This very, very important. Do not make cuts, do not suck the venom. The venom is usually, if it's from a venomous snake, the venom is usually rapidly absorbed. So with taking time to cut or suck the venom, you just increase the chances of infection because you don't remove any venom meaningfully usually. So you're not even helping the person. Do not apply tight tourniquet. This will most likely cut off blood supply, localize the spread of the venom, and even lead to disability, and that is like loss of limb in some individuals. Do not apply herbs or chemical. We don't have evidence to suggest that this actually helps. Do not apply ice pack. Do not say you want to drink alcohol, herbal medication, or aspirin. Again, there's no evidence that this helps. These practices are usually common. We see this almost all the time, especially in local the patient's clinical severity as well. Now, the specific treatment, antivenom. Now, when do we give antivenom? This is only indicated when there is evidence of envenoming. By the way, when I say envenoming, it means there is injection of venom into the body through a bite, resulting in local or systemic toxic effects. Some of the systemic effects include neurotoxicities. Like I mentioned, they could have paralysis, trouble breathing, uncontrolled breathing, cardiovascular instability. Some might even end up with acute kidney injury or acidosis. Then local envenoming around the site of bites, swelling, especially if it's more than half of the limb is involved. If the swelling is progressing very rapidly, bites on digits and other tight facial compartments, or if the bite is from a non-necrotic venom like the puff Adam. These are the scenarios or cases in which we give antivenom. Not in everybody. Remember, like I mentioned earlier, many bites are from non-venomous snakes. Even the ones from venomous snakes are can be dry bites. When we say dry bites, we will not administer venom into the body. So giving antivenom unnecessarily just exposes the patient to serious allergic reactions. So you only give it when indicated, not for everybody with snake bite. Pregnancy is not a contraindication to antivenom when it is indicated. Now we have two types of antivenom. We have the monovalent and polyvalent. Monovalent just means it's targeted to a specific snake species, like the most common species that I mentioned we have in Nigeria, the Echis ogillatus. We have antivenom targeted for that species particularly. This is only if you know the type of snake involved. Now we have the polyvalent. We give this when the species is unknown or you're suspecting a mixed exposure. It covers the common West African venomous snakes, those species that I showed you earlier. It covers four species types in the polyvalent. So depending on if we know this type of snake or not, it will determine what kind of antivenom that we give and based on availability. We administer it slowly via intravenous injections. We monitor for allergic reactions. There have been evidence and there have been cases of allergy recorded after antivenom. So this is why we give it in hospital setting only. You don't give this at home because we need to monitor for allergic reactions and treat promptly if we have any. You use specially appropriate antivenom if they are available. If not, we use the polyvalent. Patients may or may not require multiple doses depending on the severity. Now, we also give supportive treatment, especially for those that present with complication. Many of them will present in pain, so you have to give pain control. If wound, you clean and dress the wound. If you're suspecting an infection, we give antibiotics, and then those with disability would require physiotherapy. Common possible complications are renal failure, breathing difficulty, severe bleeding, tissue necrosis, or even loss of limb and permanent disability. So the point of getting to the hospital early is to treat promptly and to avoid these complications because they are more difficult to treat and they increase morbidity and mortality. Complications may develop even after initial stabilization, which is why we keep for 12 to 24 hours to monitor, and follow-up is also essential. Now, moving on to insect bites and stings. Common insects we have in our region: mosquitoes, ticks, spiders. Two species of spiders to be very wary of. These are very dangerous: the black widow and the brown recluse. Then we also have scorpions, bees, wasps. Possible outcome that a person can have from insect bite or sting: local irritation. Some may develop infection, some may even have allergic reaction. This is when you need to present to the hospital, and while some insects have vector-borne disease like malaria. Now, when we say local reaction, if you see from the first two pictures, this is an example of a local reaction from an insect bite. Some of them can be extremely painful, especially from spider or scorpion. So they can have pain, itching, redness. Usually it's more evident around 24 to 48 hours after the bite. Then we have large local reaction. The picture in the middle, you can see how significantly swollen that hand is compared to the other one. In this case, the person needs to present to the hospital as soon as possible. Then we have severe reactions, allergic reaction. They might have difficulty breathing, they might be wheezing, rash all over the body. This is a sign to run to the hospital as soon as possible. Local reactions can look alarming, but they are not anaphylaxis and they can be managed easily at home. Just like we have first aid for snake bites, we also have first aid do's and don'ts for insect bites. Now, for insect bites, first thing first, also stay calm. If we're bitten by a scorpion, for example, or a bee, we want to remove the stinger. Some of them can leave the stinger on the skin. To remove it, wash with clean water and soap. You can apply cool compress it will help ease pain in some. cases. Seek urgent medical care in case of any severe allergic reaction like breathing difficulty, facial swelling, or rash everywhere. You do not want to scratch vigorously because this will just make it worse. Do not apply any unknown home remedies. Again, there's no evidence that this improves or is of any benefit. Do not apply tight tourniquet. You're just going to cut off the blood supply. This is just some notes on what to do in case of certain insect bites. Although usually when we get bitten by mosquito, most people just ignore it. But some people actually have local reactions and they might need some cream, antihistamine cream to avoid scratching. Very important. For bee wasp, we want to remove the stinger if it's still in the skin. Apply cold compress if there's extreme pain or there's serious swelling. You present at the hospital. Scorpion, same with scorpion. For scorpion, spider, tick, you want to look for signs of these allergic reactions and present to the hospital immediately. Okay. Now, for education and prevention, for snake bites, for those involved in animal husbandry or those people that work in those high risk area that I mentioned earlier, wearing sturdy footwear like the boots can be very beneficial. Avoid night walking without light. If a person must walk at night, they should use a good light source. Keep the surrounding clear of any debris. Keep food or wood away from sleeping areas. This usually attracts the snakes. Educate the community on first aid, which is one of the most important things to do. For insect bites, you want to use insect repellents, bed nets in our regions, cover exposed skin, educate the community again on first aid. There's a picture attached here. You can see these are some common home gardening plants that we usually have: basil, rosemary. If you have some of these, try and use insect repellents around your home to avoid this attracting these insects. Key takeaways I want you to have from this presentation. In the case of snake bite or insect bite, the first thing first is to stay calm. Stay calm. Do correct first aid because this has been shown to save lives. It is very important. It makes a whole difference to the individual. Early hospital care has been shown to improve survival, so don't waste time trying to do local remedies. Take the person to the hospital as soon as feasibly possible, please. And the clinics, hospitals, healthcare centers usually should follow evidence-based guidelines. For snake bites, we only give an antivenom when indicated, not for anybody, while for insect bites, you want to watch for allergic reactions. Now, these are my references. Thank you very much for listening. Dr. Edith?
Thank you very much, Dr. Chapman, for that wonderful insights. And I believe we were able to get to from all that she has said. And remember, do not try to suck out venoms, and also don't try to apply tight tourniquets. And the most important is to seek medical care almost immediately. So now we are on to our question and answer sessions. Okay. And the first question we have here from Ina Kessel is asking, do mosquitoes transmit yellow fever? That's the first question here. And the second, we'll take the first two and talk about the rest. And do we have vaccines, especially for venoms, from the common venomous snakes in Nigeria? That's from Mr. Daniel Ilaji.
Okay, thank you for your questions. So, the first question: do mosquitoes transmit yellow fever? Yes, there is a type of mosquito, the Aedes aegypti. That's the mosquito that is responsible for spreading yellow fever. Just like how malaria is spread, it is spread from individual to individual after bite from this Aedes aegypti mosquito. Then, second question: do we have vaccines, especially for venomous snakes? Do you mean vaccines or antivenom? There are no vaccines for venomous snake bites, but we have antivenoms available in certain centers, especially in your teaching hospitals, certain general hospitals, and a few private facilities. So no, there are no vaccines, but there are antivenom available in Nigeria.
Okay, and then we also have a question here from Dr. Solomon Ehilero. He's asking, his first question is, how long is the critical window for getting medical help after a bite or sting? And then, are traditional remedies ever helpful, or do they worsen outcomes? Should the victims attempt to capture or kill the snakes or insects for identification? How can laypersons distinguish between allergic reactions and venom effects? Okay, the first one is, how long is a critical window for getting medical help after a bite or a sting?
All right, thank you for your question. The first question: how long is the critical window for getting medical help for a bite or a sting? So let me go back to my slides. Like I mentioned, for anybody with a snake bite, you want to get them to the hospital immediately. The only thing that you would stay to do is to immobilize the limb from the first aid that I showed you, because that is what would help limit the spread of the venom. So it depends on if the limb was immobilized in the first place, because if it was immobilized, then the person has some time, minutes to few hours. Then it also depends on venom, the type of venom, right? And how much of the venom was injected into the individual. The less the venom, the more time the person has, the more the venom, because this venom, they actually get absorbed rapidly. So was the person immobilized on site? If yes, then they have a few, some minutes to maybe a few hours. If not, they don't have as much time and they need to be rushed. But in any case of snake bite, you immobilize and you send them straight to the hospital. Do not waste time. For stings, like I mentioned, in insect stings, only those with symptoms of allergic reactions can present. Others can be managed at home. But if you're not sure, you can still go to the hospital. Let them determine the severity at the health center. Now, are traditional remedies ever helpful or do they worsen outcomes? Like I mentioned, these traditional practices, there is no evidence to suggest that they are of any help or any use. Instead, what they do is they delay the person from getting definitive care. You stay, you're applying chemicals, you're wasting time, and by the time you go to the hospital, it will already be too late. So please, there's no evidence to suggest that these traditional remedies are actually helpful. They just delay treatment. Third
Okay.
question: should the victim attempt to capture or kill the snake or insect for identification? Okay, not the victim per se. Maybe if there are people around, they can help, because identifying the type of snake, yes, it can tell us if it's a venomous snake, what to expect, and if this person should require longer admission or not. So the victim should be immobilized and taken to this hospital. If there are people around, they can help to capture the snake. If they can kill the snake and bring it to the facility, good and fine. But please, the victim should not stay looking for the snake and trying to capture it. Then, fourth question: how can layperson distinguish between allergic reaction and venom effects? Okay, for I'm going to assume the allergic reaction you're asking is from insect bites. I have a picture. I showed us a picture for some of the reactions. So for if the swelling redness is localized to only the site of bite, most likely the person should be fine with home remedies. But if the swelling is now expanding, especially if it's expanding rapidly, or the person has rash all over the body, or the person is having difficulty breathing, they're wheezing, they're feeling weak, tired, feeling anyway, then they should go to the hospital. Then venom effects, like I mentioned, any snake bite, anybody with snake bite should go to the hospital. Better for it to be determined if it's venomous or not at the hospital. I won't advise this to be done in the community setting, because again, you can decide to say you want to wait and see if they're having a reaction. Some snake bites that have envenoming can actually have delayed reaction. So do not wait to if it's venomous, but just go straight to the hospital. But for allergic reaction, These are some of the things that come up.
Okay, so generally, time is of essence. After a snake bite, it's expected that one seeks medical care almost immediately. Of course, if it's a venomous, if after being checked and seen by a doctor that it is a venomous snake, it's important for the antivenom to be administered at least within the first 4 hours. So early arrival is in fact very, very important. We have another question here. I think this is actually from Mohammed, Mr. Mohammed Yahaya. He's asking, please, can the doctor take us through the snake bite first aid again? Thank you. Just wants
Yes, I will gladly take us through that again. So I have it on screen. First aid do's for snake bite. Remember the acronym do right. Reassure patients, immobilize the bitten limb and keep it just below heart level. Get to the hospital and tell the doctor. We
okay.
have the don'ts. That's for the do's, right? Then we have the don'ts. Please do not make cuts. Do not suck the venom. Do not apply tourniquet. Do not apply herbs or chemicals. Do not apply ice. Do not drink alcohol, herbal medication, or aspirin. These will only increase the risk of infection, tissue damage, and delay definitive care.
Okay, so Mr. Daniel is sending us his contribution. He says community health workers should be trained on how to effectively manage snake bites, including administration of antivenoms. This is important because most of these snake bites occur in rural areas and timing is very important. That is very true. Very, very true. Thank you so much for that wonderful
Actually,
contribution.
yes, that's right. And community health workers are actually trained to recognize and give first aid for snake bites. It's just that they are not trained to give antivenom because they might not be able to manage the adverse reaction. But yes, they are trained to recognize and give first aid. And then to know when to refer, which is very important in community level.
Okay, so Mr. Austin Odion is asking, he says, thank you for your presentation. Are there specific antivenom or different species of snake? How do you know the specific antivenom to administer?
Okay, so like I mentioned, we have the monovalent antivenom. This actually targets a specific species of snake. For example, we have the Equitab G. This is known to target the Echis ocellatus that I mentioned earlier. Let me show us the picture. This this carpet viper. And because it's the most frequent cause of snake bites in Nigeria, we have this antivenom available in Nigeria. Then if you do not know the species, like I mentioned, we give the polyvalent. It covers four different species of snakes. Now, how do you know the specific antivenom to administer? If the person can give a description, or maybe there are some people that actually kill the snake and bring it with them to the facility, then we have an idea of the kind of snake and we can give a monovalent. But if the person cannot provide a description, you don't know what type of snake, they cannot remember, and we just give the polyvalent to be. And this is why we also give multiple doses just in case.
Okay, Mr. Adamosedo, can you please unmute yourself and ask your questions, please? Mr. Adamosedo, I can see your hand raised. Can you please unmute and ask your question? Okay.
Maybe it was an accident.
Mr. Adamosedo, are you there? We can see your hand raised. Do you want to ask a question? You can kindly unmute yourself and ask. Okay, let's go ahead then. So, Mr. Daniel Nadi also said, secondly, availability of antivenom in all health facilities seriously advised.
Yes, it's the thing of concern is just that this antivenom, they are very expensive
Okay.
and they're not. Okay, so they are very expensive. They are costly. Production can be complex. The supply chains to actually bring it to Nigeria are limited. So this is why you might not find antivenom in all facilities. But yes, it would be great if it's something that could be available in hospitals, well, especially during the rainy seasons when these bites are more common.
Thank you, Dr. Jama. Would like to give the floor to our medical director, Dr. Obi Nadi.
All right, good morning, everybody. Can you hear me?
Yes, sir.
All right, thank you, Dr. Fatima Jama, for your presentation on snake bites, the do's and the don'ts. It's a very common thing in our climate, especially as some people said in the rural areas of Nigeria. But the fact remains that it's the do's and the don'ts that had made this become a problem in the society. By the time we keep our surrounding clean, by the time we wear good clothing and make sure that we are free of debris, we might not be able to have snakes around. But whether how we get snakes around, there are things we need to do so that we avoid envenomation. Of the truth, what sparked this presentation was the case of a popular song artist that died in Nigeria as a result of snake bite, envenomation, no antivenom. Before we criticize the health care facility, the questions I would leave us with this morning is, did the patient or the client keep to the rules, they do right that he or she was supposed to do before you get to the hospital? I know it's particularly difficult to say you are bitten by a snake. By the story I heard she was bitten and she woke up. You are bitten by a snake and you keep calm. It's very difficult, but you just have to be calm because when you start panicking, you start doing a lot of wrong things. And those wrong things will be the things that cause the problem. For the young lady, I also read that she was beaten on the wrist. Truth is that the wrist is actually near the heart. You know, we say part of the do's is to keep the stricken limb below the heart. So when you are beaten on the wrist, see, it's not very easy keeping it below the heart. There are tendencies that are going to raise it above the heart. Secondly, I also read that a tourniquet was tied around her arm. That same tourniquet was now loosened in the hospital. And then that was where I think the envenomation probably started. And part of the do's is that instead of tying tourniquet, just put a sling, or put a split around the limb. Do not tie tourniquets. When we keep to this and then rush to the hospital immediately, the question I leave us to is, how long did it take for this client from the time she was bitten by the snake to get to the hospital? In a country like Nigeria that we are not 100% sure of the healthcare facility, I think it behoves on us, like listening to this presentation, to steer our mind, do the things we can do as first aid, and don't do the ones that we shouldn't do. Some people make scarification marks. Some people start rubbing a lot of things. Some people start applying a lot of stuffs on the body because they are bitten by a snake. About 70% of these snake bites are actually not harmful. And that is the truth. It's been studied and it's the truth. The few that are harmful are the ones that we are talking about. Just a very small percentage of it. But it's difficult to be bitten by a snake to keep calm. But I feel listening through or going through this webinar today, our mind will be realigned to what we should do when we're bitten by a snake. And then you can take this message on, because this is not just only for our own assimilation. You've listened to it, you've heard it. You're now supposed to be a provider of information to those that don't know it. Get to your villages or to your people that stay in the village and say, hey, when you are bitten by a snake, don't do 1, 2, 3, 4, 5. Because traditionally, whether you like it or not, you see, when you're bitten by a snake, they say, no, tie it, tie it, tie it, so that it doesn't leave the place without no scientific basis. But you tell them, no, you don't need to tie it, because it is part of the lecture we had. We don't need to put cups. You don't need to raise these things above your heart. What are you saying to? Try to get to the hospital immediately. So when you get to the hospital, they will check for signs of local envenomation or systemic envenomation, which you cannot do as a layman. Get to a good hospital. And I know proper hospitals, if they feel that it's environmental and they don't have it, they'll shift you. But the catch too is get to the hospital on time. Get to the hospital on time. Don't wait. You've been beaten, you've been beaten. Do what you're supposed to do, then face the road to the hospital. By the time you do all these things, I'm very sure that we will not fall victims of having or dying from a snake envenomation. And just like we said, most of these venoms are, they don't stock it in the hospital. But once you get to the hospital, the doctor himself or herself tries to check for whether this is a problem or this is not going to be a problem. And in so doing, he or she will start running out looking for antivenom. So the time from the bite to the hospital is actually very critical. And what you do when these things happen, actually very critical. It helps in what happens thereafter. So that is just what I need to. There are no vaccines, as you've said, because it's not something you say you inject to protect against envenomation. It's when it happens that we start looking for cure. So thank you very much, and I hope that this presentation has enlightened us to learn one or two. It's going to be continuous. It's going to run every last Saturday of the month. So we need to learn a few things about this so that we can live a healthy life. We can take charge of our health. You are your own doctor. Because before you get to the hospital, you should be able to tell the doctor what is wrong with you. So you are your own doctor. So you should learn to take care of yourself, whether it's snake, whether scorpion, whether spider. Now, human bites too, although it's not part of this presentation, it's not also good, because the human mouth contains a lot of toxins too. Sorry, a lot of bacteria that it can inject into you. So we are not advising human bites on the long run. So whether snake, whether spider, whether human, all bites are essential for you to seek medical immediately. Thank you for the presentation, and thank you for participating actively, to everyone that participated. And please, our learning objectives are clear. Take it home, take it down, take it to other persons, so that they may be able to understand and learn why they were not here. Thank you very much.
Thank you very much, sir, for that wonderful contribution. I'd like to thank viewers and all those who joined in this webinar for your presence, for your attention. We do appreciate you. And would like you to join us the same time next month. And also remember that this webinar was proudly brought to you by eClinic and Diagnostics. We're located at number 3 Agadas Crescent, Wuse 2. And we also urge you all not to always seek medical attention, okay? And that the webinar is for education purposes and always endeavor to seek.
Dr. Det, I think there are some questions in the comment section that just came up.
Okay. Miss Dr. Solomon Ihidero. Okay, when we were talking about the human bite, then he now asks about human kiss too, if it can be venomous. That's his question.
No, human kiss differs. Human kiss can be harmful as it transmits bacteria and viruses like cold sores. You can have herpes simplex virus. You call it kissing disease. You can also get cold, flu, or viruses. That is what kiss can give you. So kiss cannot, it's not venomous or not, but some of these bacteria can be transferred. Viral infections, respiratory illnesses. When you have a bad oral hygiene too, all these things can be transferred through human kiss when you have severe allergy. And then worse and very, very important is when people kiss newborn or infants. You see people give birth to a newborn and infant. You don't know what you are carrying, so you just want to kiss the newborn. So newborn have gotten some diseases that they didn't bargain for because the immune system is still very low in getting immune from these things. So yes, human kiss can be harmful if the person kissing you has some bacteria and viruses in him or her. Thank you.
All right. Thank you so much. We do appreciate your presence. And like I said earlier, this webinar is brought to you by eClinic and Diagnostics Limited, and we are located at number 3 Agadez Street, Wusi2, and also at number 7 Factory Road, off Ezuko Road, Aba. And we walk around the clock to lead you to a better health. Okay, we also advise that you take charge of your health and always remember that prevention is always better than cure. All right, thank you so much for joining, and we'll see you same time next month. Thank you so much.
Dr. Edith, there are some questions that you've not answered. Hello, Dr. Edith.
Hello? Hello?
Hello, Dr. Edith, can you hear me?
Yes, I can.
I said there are some questions in the chat box that you've not answered.
Okay. Questions are, should we come to eClinic? Dr. J, should we come to eClinic in the case of snake bites?
Okay, thank you for that question. Yes, we're actually currently working on getting the antivenom. We might even have it on ground already. So we have the polyvalent antivenom. So yes, you can come to eClinic in case of something.
So the truth is that you can come to the clinic and then you can be looked at and then clinically seen to know whether you actually need the antivenom or not. But if you have snake bite, you can come to the clinic because you have doctors around the clock. Whether you be administered antivenom or not is left for the doctors to note. That is it.
Okay. And there's also a question here. We're told about cats and dog bites at any point.
Sorry, before
Get that question.
that, someone
We
asked.
talked about cat and dog bites at any point.
I'm sorry, Dr. Edith. Before that question, someone asked, I heard people advise on applying ice. How true is this?
Yes.
So applying ice is one of our don'ts in the first aid that I presented earlier. What bites? The people believe the reason they apply ice is because they believe it reduces swelling, but it actually does not. in this case, it even worsens tissue damage because when you apply something cold, what it does is it constricts the blood vessels. So the supply there is even less than usual. It can cause ischemia, it can cause tissue death, it can cause loss of limb. So please do not apply ice. It's going to worsen tissue damage. It's not going to help. Then the question about cat and dog bite. No, cat and dog bite is not part of this presentation specifically. And okay, we don't have much time. I would have said if you have any questions, particular questions, we can answer it here.
Okay.
Let me just say basically, sorry, for dog bites, yes, you should go to the hospital after a dog bite because some of them we might need to administer aside anti-tetanus, we need to might need to administer anti-rabies if the person meets the criteria for it. So yes, come to the hospital so that we can determine if you need one or not. Then also some big dogs can cause large crush injury, local injury. We might need even antibiotics in case of infected cases. So yes, in cases of dog bites, you should come to the hospital or facility, especially if it's not a home dog. Then also for cat bites, most cat bites are harmless, but again, if it's not a home cat, you should probably come to the center for tetanus, anti-rabies.
Okay, and then someone asks, I had a scorpion sting. I was given a whole dog onion to chew and was advised not to go to the hospital, which I did. How safe is that? I was advised not to go to the hospital, which I did. How safe is that?
Okay, so for our insect bites, again, do not apply home remedies. There's no evidence that bog onion does anything to help. Okay. For some scorpion bites, the most common thing they cause is severe pain and local irritation. So likely you didn't have any adverse effects from that because you just had some local reactions. But in the event that you could have been having allergic reactions, I don't believe that there's no evidence to prove that bug on you will do anything to help you. So next time if you're not sure, please do go to the hospital if you're not sure.
And it's important to note that local remedies would not
You just waste your time.
substitute medical treatments. Yeah. And also being monitored in a hospital setting is also very important to abate some complications that may come as a result of the sting or bite. Right. Thank you so much, and we thank you all for attending our webinar. See you same time next month. Thank you so much.
Thank you everyone for listening. Have a nice day.